So this is our client program presentation. I'm Ashley Kovacs.
I'm Rachel O'Hara.
And let's get started. So just a brief introduction. Casey is a 69-year-old male. He is very motivated. He already currently participates in a very rigorous exercise program and was also very excited to learn some new exercises with us. So to give a brief overview of his medical history, Casey was diagnosed with cardiovascular disease, specifically atrial fibrillation, in 2009 and then did experience a second bout in 2016. He is also currently taking medications for high blood pressure, which he was diagnosed with in 1998. He did also experience some cancer and some other injuries, which I will further discuss going forward. And then just a brief exercise history. He does currently participate in exercise regularly for 30 minutes, 5 days a week, and specifically his resistance training is 3 days a week at 25-minute sessions, and he's been participating in this program for over 18 years, but doing a general full body exercise program. And then he participates in aerobic exercise 3 times a week for 40 to 45-minute sessions on the stationary bike. So we conducted a needs analysis on Casey, and he specifically wanted to improve his golf swing. And so his movement pattern for a golf swing would include a lot of trunk, shoulder, a lot of upper extremity, and a lot of hip muscles. We also did a physiological analysis, and as you can see in this table right here, a golf swing specifically uses the ATP-PC energy system without any contribution from glycolysis or aerobic energy systems. His injury analysis from the previous slide, he does have degenerative disc disease. He also suffered a right shoulder impingement as well as lateral epicondylitis. Casey does not currently complain of any pain or symptoms associated with any of those, but we did ask him to let us know if any of that changed throughout our time with him. Based on his current training status, although he does participate in exercise 3 times a week and he has been doing so for over 15 years, the types of exercises he's currently participating in are not high-level skill, and so we set him as an intermediate training status. Casey's 3 main training goals. 1 involved increasing his trunk and shoulder range of motion while swinging a golf club. He's very into golf and wants to improve his golf swing. He also wants to improve muscular endurance to continue losing weight of 15 pounds. And he wants to strengthen his abdominals to help stabilization of balance and preventing future falls.
Okay, so now we're looking at our resistance program overview. So basically a table representing periodization, so showing progression. Now, we only had 2 weeks to work with Casey, so that's what's represented at the top. Our goal was hypertrophy leading to strength. Ideally, strength is the ultimate goal, but given the short time, we would be building up to strength. So underneath there is showing our load and reps. And so we're showing a linear progression. So from a red, green, blue TheraBand to essentially just a green and a blue. So upping the resistance is what's representing the load. And then it's broken up into 2 days per week, which is what we had him doing. So in reference to the Fit VP, F being frequency, so we had him working out 2 days a week for 2 weeks. Intensity is going to be represented by the load and the reps. The time. So he approximately was doing about 40 minutes of aerobic exercise prior to his already resistance trained program that he'd been doing. So in conjunction with our program plus his aerobic training, it would be anywhere from an hour, hour and 15 minutes. The type of exercise would be resistance training, addressing hypertrophy and strength, and then volume and progression is shown in this table. So we're just just addressing fit of the fit BB. Okay, so exercise selection. So we want to look at what his goals are. So goals are, number one, to get better at golf. And so we want to address the muscles that are really engaged in a golf swing, as well as including that muscular endurance that he wants to work on. So warm up, stationary bike. So that's what he's been doing, that's what he's comfortable doing, so we allowed him to keep doing the stationary bike. Along with that, we gave him a cat camel stretch, so really to just mobilize the trunk before any of the resistance exercises. Also really good for golf, something that he wasn't doing, and just kind of from a brief movement analysis was something that would really benefit him. From there, we went into clams, and so addressing hip abductor strength, which is something he actually didn't verbalize he wanted to do, not knowing how important it is to have hip stability during a golf swing. So from there, we go into chops and reverse chops. So the reason for the switch from lower to upper was just to kind of give those muscles a rest, given the fact that these are new exercises. There's definitely a chance for fatigue, so we want to change the body parts. So chops and reverse chops are very similar, especially reverse chop, to a golf swing. So that's being very specific to his goal, as well as emphasizing trunk, hip, shoulder, muscular strength. We supersetted those two exercises just to reverse, working muscles one way and then working muscles in the opposing directions. From there, we went to a walkout with a press. Again, kind of giving a break to the upper body, and this is going to actually emphasize the whole body itself. So we're emphasizing trunk, we're emphasizing hip abductors, and also some pectoralis major with the chest press involved. From there, we went to external rotation and internal rotation of the shoulder. So this was really good for working those rotator cuff muscles, which is going to be really good in his golf swing. Also supersetting these just to work opposing muscle groups. And then just corresponding to the different exercises, we have the different resistance. And this was basically chosen, which we'll discuss later, based on what intensity worked the best for him that allowed him to have the best outcome with each exercise. And I think we can move on.
So just to briefly discuss our results, we did have a few revisions. So initially we had Casey performing medicine ball side steps. And although he didn't complain about the exercise and he thought it was very doable, we did notice that he was experiencing some knee buckling and not activating his abdominals. And so we regressed him to sideline clams to really target those hip abductors without having to use any postural control. And then one other revision we had to make was initially we were using a TheraBand to perform the chops and the reverse chops. Casey was not compliant with this particular exercise on the second week, complaining that it was inconvenient to try and get the TheraBand to stay on a door frame or things like that. And he was also having a disconnect between holding the TheraBand and what it felt like to hold a golf club. And so we ended up moving him to a weighted machine, chops and reverse chops, which he felt much more confident with and felt like he could continue that moving forward. Besides those two, Casey was very compliant with all of the exercises and he felt very good about them. So as I briefly discussed, compliance, he was very compliant. Besides not doing the medicine ball side steps or the chops and reverse chops, he did participate in our program 2 times a week and incorporated it into his current training program. And then just to follow up, I do think that Casey will be using our exercises that we gave him in the future, but I don't believe he'll use them in the same format or structure that we had given him.
Okay, so reflections on the project itself. So feedback from Casey was really great, and it was nice to see that just within 2 weeks, he really enjoyed the program that we came up with for him. And so it was really good to work hands-on with a a patient rather than, we're learning all these different techniques and methods and how to make a program. And so to actually work with a patient and receive good feedback from them was really rewarding. So future direction. So I think the only thing that would have been good would be a full movement analysis when we had done the interview the first day with him, just to really get an idea of how he looked prior to even going into the gym and running through the exercises. Also, that first day, trying the exercises, we weren't going through the full sets, we weren't going through the full reps. It's just kind of a matter of, this is how it works, and let's see how you are compliant with it. So that would also be good, if we had extended time. Clinically relevant, so this was a really good project, just like as I was saying, in terms of getting to work with a patient. And so for us becoming PTs, what's really important is gonna be building that rapport with your patient and making them feel that they can trust your knowledge and your ability to put together a program that addresses their goals specifically. Just to really, we wrote down a patient-centered treatment plan. So the patient is where we're centering all of this information that we're putting together to make an exercise program for them. So we got, that hands-on experience to practice what it would be like to have our own patients and come up with a program.
And that's going to be the end of our presentation. Thank you.